So the philosophy of these guidelines has always been two big things. One is that for those who work in the private sector specifically, they need best practice guidelines. The state sector obviously has its own guidelines. The private sector has slightly more resources in many cases. And so there's always been a need for guidelines that cater for a society or a group of doctors who may have slightly more resources at their disposal than the state sector. But beyond that, it's also proven for many years very, very useful for those in the public sector as well. And the reason really is that these are written by clinicians for clinicians, and they cover a lot more clinical scenarios that come up in common situations in those looking after HIV patients, which are not covered in the state guidelines, such as how do you look after the patient with renal disease if they have HIV.